So welcome, Gidi, and today's talk is Prozac Baby, 25 years of Motherisk research into SSRIs and alcohol in pregnancy.
Depression in pregnancy affects up to 20% of pregnant women. You would think it's too high. I thought it's too high. But then we began to measure on them their depression level when they call us and come to see us using the Edinburgh score. And you know that's about right. Many women don't call it depression. They're anhedonic, they don't feel well. And you know what? In multicultural Canada, many women will not tell you they're depressed. You don't talk. In a lot of cultures here, people don't talk about mental illness. Mental illness is worse than cancer. So you don't have the openness to talk about it. On Prozac, the first study, we show that Prozac does not affect the development of the child. Before that, in JAMA, we show that it does not cause malformations. The problem is that a lot of physicians either stop the medication on the woman or give them homeopathic dose. If they can cut the tablet into 4 pieces that can be seen only in microscope, they will do it. Rule number 1 in pharmacology is give the minimal therapeutic effective dose, not the minimal dose. It has to be effective dose. And I'm saying it because we see a lot of women that take a dose that cannot do anything, not to even a cat. And here I'm switching gear. Rather than just showing you the science, after doing this for about 25 years, one day I thought, what does the baby think when he hears all that? And so I'm going to inflict into it some of the Prozac Baby. It's a new book that came out 2 months ago. And so there will be some statements by a baby, and you will know it because it will show the picture. I was conceived last night at 4 a.m. Sarah and Matt came from New Year Eve's party quite drunk. I'm not sure she was awakened during the fluid exchange. Clearly not awake enough to notice that he did not use a condom. 50% unplanned, remember? I'm 1 week old. Mom is quite depressed, but she told her girlfriend that with the Prozac, she feels much better. Sarah's mom called. Sarah Moms is the bad guy in this story. Mom was very upset. Her mom told her that Prozac can cause terrible things to unborn babies and that she has read about it in a women's magazine. Mom stopped taking a Prozac. Gradually, she becomes quite depressed. Mom's mom made several phone calls to an old friend of hers, an obstetrician, and booked an abortion for March 16. Not unusual. We intervene in a lot of women who are already booked for abortion because someone told them something. This is my last day. Sarah is becoming unhappy by the minute. She called the abortion clinic and asked some questions about when and how and all that. As you hear here, there is good news. Abortion did not occur. I won't tell you why, but you may want to read it. Mom had another anxiety attack. Her mom told her that she read in the newspaper that Prozac babies may be born very agitated, trembling, and have difficult breathing. That said, we'll call Motherisk tomorrow. Well, that's not untrue, what was written there. Similar to the adult who stopped it cold turkey, if a baby saw the drug for 9 months, he or she will have withdrawal. It doesn't happen in every case. It happens about 10 to 30%. And they will have the typical withdrawal, which many of you see with narcotics in the nursery. However, there's one different with the SSRIs, respiratory distress. We don't know why. I think we have a good idea, which I'll show you in a minute. And the good news, it's resolved spontaneously within 3 to 5 days. The importance is that the woman may not be released home like we throw now moms home after 1 day. If she's depressed and treated, this is a baby that probably should be looked at for longer time. Back to our baby. Today is the due date. The aquarium began to push my head. Once out, I remembered I need to scream. In prenatal class, the lady said that if the baby is silent, they resuscitate him. I don't know what it means, but it sounds quite torture, so I screamed. And what about your Prozac? Asked Granny, that's the bad woman. It will poison your milk. Yes, again, this was the voice of my grandmother.
So in thanking you for a wonderful presentation, let me say that the author gave me a copy of Prozac Baby some time ago, and I read it at one sitting, and it's simply put brilliant. Thank you very much.
Thank you.